Hi, I'm Dr. Iadeluca here. I'm on our West 26th Street office showing you a bit about the spine and some degeneration. A lot of patients get degenerative changes, so I want to show you some examples of what happens as your joints get older. A lot of patients will say, grandma's a little bit shorter, I think her bones shrunk. And so the bones themselves don't shrink, it's the little discs in between. And you have many of them throughout your spine. So as these discs degenerate and get smaller, you will get shorter. And so this is a normal patient. This person doesn't have any arthritis, no spurring, it's smoothed off. And as you see them getting some spurring here, you see that nice spur right there, and you see how the disc space is a little bit less. You don't need to be a doctor to understand which patient can bend over and move better. And then this patient has a nice big fat disc bulge there. That's normal. And up here, that's normal. And then as we age, these discs will degenerate, and if you look here, you can see that starting to bulge as this gets thinner. That can bulge out. When that presses right into the nerve, you can get some sciatica or back pain, or pain down the leg, and if this is a neck vertebra, it will radiate down your arm as well. And so that can also bulge in the middle and put pressure directly on the disc, and so you have that disc bulge here. But as we age, your bones will degenerate and get arthritic change. And so that's what we see here. And then if you look at this person, the disc is almost gone, and these vertebrae are nearly fused together. And it's common, and I did a series of x-rays or a series of videos on x-ray. It's common for these vertebrae to fuse. So when our patients are 45, 55, 60 or older, we'll want to take some x-rays, because do they have normal a spine? Which joints are normal? Which ones have a little bit of arthritis? This is moderate. And which ones are, almost bone on bone? This one right here, this is the nearly fused. Once this disc completely degenerates and goes away, these vertebrae will form together and they will fuse. So these will fuse together, and then we're never going to adjust that joint. The ones above it and below it may stay normal, and we'll try to work with those to get the joint mobility going. As we're adjusting the spine. But we want to take some x-rays to see exactly how you look on the inside. And then if the patient has a lot of sciatica, radiating pain, or even leg weakness, then there's some other imaging we can utilize too, and that would be MRI. And it's common for patients to bring their MRIs in or for us to review them. But this is a little bit about the spine and some degeneration, some complicated neuroanatomy, and a lot of doctors use really big words, but if we take away all the big words, it's a process. And I always equate it to like tooth decay. Your teeth will decay, and we just create a lot of big words for, spinal stenosis versus, all these other different degenerative processes. But it's one big, long process. It's a decay as we age and as we have old injuries and problems. And so you go to the chiropractor, we get you adjusted. Now, can we unwind and make this person that the bones are fused together? We can make them normal again, and then no, we cannot. But these patients that have degenerative changes, we get the joints adjusted and keep them moving, and they'll do much, much better in life. And that's why chiropractic works especially well for patients, 35 to 60 plus, because we can get the joints in your back moving much better. An example of that would be one of our golfers. We have tons of golfers. They all come in the spring, and they're like, "Hey, Dave, from the winter, I've just been tight. I'm locked up. What can you do for me?" And we start getting them adjusted, and they start feeling younger. And what are they feeling younger? We're getting these joints that are degenerated somewhat, moving better. And so that way they get more mobility out of their golf swing or whatever they're doing in life. So a little bit about chiropractic and degeneration and some things we do. Thanks so much.